Baby development. What's happening in week 2? Manam growth. At just 2 weeks old, your baby is doing something that most parents don't expect. They are beginning to stay awake for longer stretches, and when they are awake, they are watching you more closely than you might realize. Week 2 is a week of quiet but significant progress. The dramatic adjustment of the very first days is beginning to settle, and your baby's body and brain are shifting into a new rhythm. This is the week when many families start to feel like they are finding their footing, and when your baby starts to feel, for the first time, genuinely at home in the world. Let me walk you through exactly what is developing this week, so you can understand what you are seeing and why it matters. Growth. The most important physical milestone of week 2 is weight. If your baby lost weight in the first few days, which, as we discussed last week, is completely normal, they should now be gaining it back steadily. Most babies gain around 5 to 7 ounces per week once feeding is well established, and by the end of week 2, the majority of newborns have returned to their birth weight. Your pediatrician will check this at your 2-week visit, which is one of the most important early appointments. If you haven't scheduled it yet, please do so. This visit gives your doctor a chance to assess feeding, weight gain, jaundice, healing of the umbilical cord, and your baby's overall development. Speaking of the umbilical cord, in week 2, many babies still have the cord stump attached. It will gradually dry, shrivel, and fall off on its own, typically between 1 and 3 weeks of age. Keep it clean and dry. Fold the diaper down below it to allow air circulation, and avoid submerging your baby in water until it has fully separated. Do not pull it off, even if it looks like it is barely attached. If you notice redness, swelling, or a foul smell around the cord, contact your doctor. Your baby's skin is continuing to change this week. The initial peeling that many newborns experience, especially on the hands, feet, and ankles, is normal and does not require any special creams or treatments. Their skin is simply shedding the outer layer that was protected by fluid in the womb. Underneath, the skin is healthy and intact. Muscle tone is also developing this week. Your baby is still predominantly in a flexed, curled position, but you may begin to notice that their limbs are slightly less tightly drawn in than they were at birth. This is a sign that the nervous system is beginning to mature. When you place your baby on their tummy for supervised tummy time, they may briefly lift their chin from the surface, just for a second or two. This is the very beginning of the neck strength that will, over the coming months, lead to full head control. In week 2, your baby's brain is doing something remarkable. It is beginning to organize the flood of sensory information it has been receiving since birth. In the first week, everything was new and overwhelming. Your baby's brain was simply absorbing. Now in week 2, patterns are beginning to emerge. Your baby is starting to recognize routines, the particular way you hold them for feeding, the sound of your voice shifting into the soothing tone you use when they are upset, the smell of you when you pick them up in the night. This is the beginning of memory. Not the kind of memory that involves conscious recall. That comes much later. This is implicit memory, the brain learning to predict what comes next based on what has happened before. When your baby calms the moment you pick them up, before you have even begun to soothe them, that is implicit memory at work. Their brain has already learned. This person means safety. The visual system is developing rapidly this week. Your baby's focus is sharpening, and they are becoming more capable of tracking a slowly moving object with their eyes. If you hold a brightly colored object about 10 to 12 inches from their face and move it slowly from side to side, you may notice their eyes following it, briefly and imperfectly, but following nonetheless. This is the visual cortex beginning to build the pathways that will eventually allow for precise, coordinated vision. Your baby is also becoming more sensitive to sound this week in a meaningful way, not just startling at loud noises, but showing a preference for familiar voices. Many parents in week 2 notice that their baby will turn their head in the direction of a parent's voice, even from across the room. This preferential response to familiar voices is a beautiful sign that the auditory centers of the brain are making connections. Onsocculation. Week 2 brings one of the most emotionally significant developments a parent will observe in these early weeks: the beginning of what researchers call social engagement. Your baby is not yet smiling socially. That milestone, as I mentioned last week, comes around 6 weeks. But in week 2, something else is happening. Your baby is beginning to gaze at your face with increasing intentionality. They are studying you. If you look at your baby and hold their gaze, you may notice them becoming very still and very attentive, as if they are concentrating deeply on the information in front of them. They are, in my clinic. Parents often describe this as the moment they first felt truly seen by their baby. The baby is not smiling yet, not reaching, not responding in any obvious social way, but that focused, serious gaze communicates something unmistakable. I am here. I know you. Crying is still your baby's primary means of communication this week. But many parents begin to notice in week 2 that they are starting to distinguish between different types of cries: a hungry cry, a tired cry, an overstimulated cry, a cry that simply says, "I need to be held." This is not just parental intuition. Research supports that different cry patterns in newborns do carry different acoustic signatures, and parents, especially those who are spending the most time with the baby, develop the ability to read them relatively quickly. Your baby's emotional state in week 2 is still largely governed by physical needs. When they are fed, warm, and held, they are content. When any of those needs are unmet, they cry. This is not manipulation. It is neurobiology. The parts of the brain responsible for complex emotional regulation are years away from maturity. Right now, your baby experiences discomfort, and they signal it. Responding to that signal is your most important job. Monomfertilmetagroud.
Alertness.
The primitive reflexes we discussed in week 1, rooting, sucking, moro, grasp, stepping, are all still present and active in week 2. They will remain so for several more weeks as the brain gradually assumes voluntary control over movement. One new ability worth mentioning in week 2 is a modest improvement in alertness. In the first week, your baby's wakeful periods were brief and often unfocused. In week 2, you may notice slightly longer periods of calm alertness, the state where your baby is awake, quiet, and visually engaged with the world around them. These alert periods, even if they last only 5 to 10 minutes, are precious windows for interaction and learning. You may also notice your baby beginning to make small, non-crying vocalizations in week 2, soft grunting sounds, small sighs, or quiet murmurs. These are the very earliest precursors to the cooing and babbling that will emerge over the coming weeks. Your baby's voice is warming up. In Luffy. Over the course of my career, I have had the privilege of watching thousands of families move through these early weeks. And week 2, in my experience, is often the week when the emotional weight of new parenthood begins to truly land. The adrenaline of the birth has faded. The visitors have gone home. The initial shock has settled into the reality of daily newborn care. And parents, often for the first time, look at each other and think, This is our life now. That realization can feel beautiful and terrifying in equal measure. What I want you to know is this: what you are feeling is normal. Whether that is joy, exhaustion, love, anxiety, grief for your previous life, or some complicated mixture of all of these, it is all normal. And it is all part of the process of becoming the parent your baby needs. Manam fertilmente graude. A question I hear frequently in week 2 is this: my baby seems to be awake more at night than during the day. Is something wrong? Nothing is wrong. What you are experiencing is a very common newborn pattern called day-night reversal. Your baby's circadian rhythm, the internal biological clock that regulates sleep and wakefulness, is not yet developed. In the womb, your movement during the day rocked your baby to sleep, and the stillness of night woke them up. Now that rhythm is playing out in reverse. The good news is that this does resolve. Typically over the first 4 to 6 weeks, as the circadian system matures and your baby begins to respond to environmental light cues. You can help this process along by exposing your baby to natural daylight during the day and keeping nighttime interactions calm, quiet, and dimly lit. But please be patient with yourself and your baby. This is a phase, and it will pass. Manam fertilmente graude. Every baby moves through week 2 at their own pace. Some babies are already showing strong alertness and clear feeding patterns by the end of the 2nd week. Others are still adjusting, still sleepy, still finding their rhythm. Both are normal. The single most useful thing you can do this week is to observe your baby without judgment, noticing their cues, their preferences, their particular way of communicating. Every baby is different, and the parent who pays attention to their specific baby will always be better equipped than the parent who is trying to match a textbook timeline. If your baby is feeding well, producing adequate wet diapers, and growing, you are on the right track. Everything else is secondary. Manam fertilmente graude. Week 2 is a week of subtle but real progress. Your baby is becoming more alert, more responsive, and more present in the world, and in your life. The connection you are building right now, in these quiet early weeks, is one of the most important things that will ever happen for your child's development. In our Parent Guide video for week 2, we will talk about how to support your baby's growing alertness, how to begin establishing gentle routines, and how to take care of your own well-being through this demanding but extraordinary time. Subscribe to Tiny Steps Weekly so you never miss a video, because every tiny step matters.